Hi there, my name is Dr. Deer. I'm a GP at Hiyos First Care, and today I'm going to talk to you about the 8-week baby check. So when you arrive at your appointment, remember that you'll be given 2 appointments. One is usually for the mother check and one is for the baby. So of the 2, make sure you arrive at the earliest appointment. The second thing is, do note that we will be asking you to undress the baby fully so that we can do the full examination. So make sure that you've dressed the baby in such a way that you can quickly undress them in the appointment. We will be asking you a few questions, and that's to do with the baby, whether they're doing well, they're sleeping well, they're smiling, and if they're feeding well. So let's talk about the examination now. Hopefully your baby will be smiling just like this one when you arrive. So when we begin the assessment, we do a head to toe examination. So we start off with the head and we feel for the fontanelle, which is a soft spot on the top of the baby's head. We also take a measurement of the head circumference, so that's the size of the baby's head. We look at the eyes and the red reflex, so we'll be shining a light at the baby's eyes. We'll be looking at the mouth and the palate inside, and we'll be asking you about the feeding and if there's any problems with that. We'll be looking at the head and neck control. We'll have a listen to the baby's heartbeat, and we will feel for the pulses for the baby. Next, we'd move on to a genitalia examination. If it's a boy, then we'll be checking for the testicles, and then we also examine the hips as well. We'll be moving the legs during that part of the examination. Next, we move on to the spine, so we will turn the baby to the side and we have a look at the back of the baby, and we may press down as well along the back to check it's all normal. During the assessment, we will also be measuring the weight and we may measure the length as well. That concludes the majority of the 8-week examination, and if all is well, we will be signposting you to the next steps and the immunisation for the baby. One request we will make is that if you do happen to be changing any nappies, please make sure you dispose of the waste outside of the room, because we'll be having patients coming in and out all day. Thank you.